The United States is facing a new health concern, a rise in cases of human metapneumovirus or HMPV. This respiratory virus is not new, but it is gaining attention as infection rates climb. HMPV often causes mild cold-like symptoms, but it can be more serious for young children, older adults, and those with weakened immune systems. Throughout the COVID-19 pandemic, we saw a decrease in many common respiratory viruses. This was likely due to increased hygiene measures and social distancing. However, as these measures have relaxed, we are seeing a resurgence of viruses like HMPV. The Centers for Disease Control and Prevention, or CDC, is closely monitoring the situation. They are tracking HMPV infection rates and providing guidance to healthcare providers. Understanding the spread and impact of HMPV is crucial to protecting public health. One of the key indicators of HMPV activity is the positivity rate. This refers to the percentage of tests that come back positive for the virus. Recent data from the CDC shows a concerning trend. In the first week of January 2025, the positivity rate for HMPV was over 2%. This is a significant increase from the previous week, when the rate was 1.77%. To put this in perspective, the positivity rate was just 0.87% in early December 2024. This rapid increase suggests that HMPV is spreading quickly throughout the country. Health officials are particularly concerned about this rise because it coincides with the flu season, putting additional strain on the healthcare system. It is important to note that these numbers may not reflect the full extent of HMPV circulation. Testing for HMPV is not as common as testing for other respiratory viruses like influenza or COVID-19. This means that many cases of HMPV may go undetected. While HMPV is affecting the entire country, certain regions are experiencing higher infection rates than others. The central U.S., specifically Iowa, Kansas, Missouri, and Nebraska, has become a hotspot for HMPV. The positivity rate in this region is over 5.8%, which is more than double the national average. Another region with a high positivity rate is the Pacific Northwest, including Alaska, Washington, Oregon, and Idaho. In contrast, the Mid-Atlantic region, which includes Pennsylvania, West Virginia, Maryland, Rhode Island, and Virginia, has reported a decrease in HMPV cases. The reasons for these regional disparities are not entirely clear. Factors such as population density, weather patterns, and vaccination rates may play a role. However, more research is needed to understand the complex interplay of factors contributing to the spread of HMPV. Section 4. The ebb and flow of HMPV. Understanding the seasonal patterns of HMPV is essential for predicting and managing outbreaks. Looking back at the past year, we see a familiar pattern of viral activity. From July 2023 to June 2024, HMPV activity was relatively low during the fall and early winter months. However, as winter transitioned into spring, cases began to rise. Between late March and early June 2024, the positivity rate for HMPV spiked, reaching over 8%. This peak coincided with the end of the flu season and the beginning of spring allergy season. It is possible that the overlap of these respiratory illnesses contributed to the surge in HMPV cases. Interestingly, HMPV activity did not completely disappear during the summer months. While cases declined from their spring peak, they remained at a low but detectable level throughout the summer of 2024. Section 5. The importance of testing and prevention. While we continue to learn more about HMPV, one thing is clear: prevention is key. Currently, there is no vaccine or specific treatment for HMPV. This makes preventive measures all the more crucial in curbing the spread of the virus. One of the most effective ways to prevent HMPV is through good hand hygiene. Washing your hands frequently with soap and water for at least 20 seconds is essential. If soap and water are not readily available, use an alcohol-based hand sanitizer. Another important preventive measure is to avoid close contact with people who are sick. If you are feeling unwell, stay home from work or school to prevent spreading the virus to others. Covering your coughs and sneezes with a tissue or your elbow can also help prevent the spread of germs.